Hey everyone, it's your host, Sarah. I know when the topic of returning to work comes up with clients in speech therapy, it can be daunting because it's such a big goal for the clients we work with, and it can be challenging to know what we can do in speech therapy to support our clients. And where does vocational rehab fit into things? That's why I'm really excited to have this conversation today with Dr. Peter Meulenbroek. Welcome to Speech Scope, a MedBridge podcast where we conquer challenging topics for the medical SLP. Our aim is to deliver actionable takeaways for clinicians like you through captivating discussions with experts in our field. To receive continuing education credit for this episode and access bonus resources, make sure to check out medbridge.com. Hello, I'm your host, Sarah Baar, a clinical SLP in Michigan with over 15 years of experience. I specialize in adult neurogenic disorders and the life participation approach. Our guest today is Dr. Peter Meulenbroek, an expert in the area of traumatic brain injury clients and returning to work. We'll be diving deeper into this topic, including recent research and actionable takeaways you can implement right away. Welcome, Peter. So glad to have you here. Can you get us started by sharing a little bit more about yourself and how you are involved with TBI and returning to work?
Yeah, thank you, Sarah. So I started off as a clinician at Spalding Rehab back in the early 2000s, and that was my first job out of a CFY. So Spalding Rehab is a Harvard hospital, so I got the opportunities to work with a lot of very interesting people. I worked inpatient in the mornings, outpatient in the afternoons. And as the outpatient, I was the point person for the mild TBI clinic. And I also saw a lot of individuals, who were higher level. And so we're trying to return to work after brain injury. And I worked with physicians, airline stewards, all of the trades, anything you can really imagine. And that I took those experiences with me to my PhD program. I studied at University of Wisconsin-Madison with Lynn Turkstra, where I became interested in the social communication aspects and measuring those. So when I did my dissertation, I found that social communication or social cognition are key variables with regards to return to work. One of the main reasons why people don't return to work is after brain injuries because of behavioral issues if they've been cleared for return to work and gone through voc rehab. So I continued with my research, developing assessments and interventions at Northwestern during my postdoc with Leora Cherney. And I did a stint at the University of Kentucky, and now I'm in the lovely Southwestern Virginia, in the Blue Hills region at Radford University, and it's gorgeous here. Very happy.
Oh, fantastic. What a cool journey. And you have some amazing mentors. I heard you mention Lynn Turkstra and Leora Cherney. So that's pretty cool that
very, very grateful for those opportunities.
Part of that awesome circle. So today, I'm really excited to learn from you, and we get to talk about something that can really be this pinnacle goal for the adults in speech therapy, returning to work. I know, that's the thing that clients are always talking about. What's your goal? Getting back to work. From a person-centered care perspective, I know meaningful work is really important for the adults we work with. So can you just take some time to share with us, how working impacts somebody's quality of life?
Yeah, I mean, you use the word meaningful as in meaningful work. And yeah, I mean, it's one of the most meaningful things for adults. If you think about introducing yourself at a party or something like this, or getting to know somebody, what's the first question that you answer? It's, what do you do for a living? And so it's one of those things that really it has a big, profound impact on your identity. And when you can't go to work because of circumstances outside of your control, like a medical condition, it's tremendously upsetting to your identity, to just, it gives you structure throughout your day. It gives you a sense of purpose. It's also where we socialize as adults. So for speech language pathologists, should be an area of extreme interest, to find out what kinds of conversations we have in the workplace. Who is it that we're interacting with? I found my wife in my workplace. so, don't tell HR. So it's a really meaningful place for adults. It's basically where we are most of our lives, where we spend most of the time in our lives.
Yeah. And then I know from just the financial concern, sometimes that can play into things too, but it's more than just that. And by the way, I met my husband through work also, so we'll just keep that between us.
Okay. Yeah.
And anyone who's listening. But so when I worked with TBI clients, I kind of tended to put people in two different categories with this return to work topic. So it seemed like I would think about the TBI clients who could get back to the job they had before their injury, but just maybe in speech therapy, we would be focused on accommodations and that type of thing. And then there were the TBI clients who did also want to get back to work, but it was not going to be possible for them to get back to that previous job that they had. And so I just wondered is that a good way to think about things? What type of work do you do? Do you kind of cover both of those situations? And what are just some of the clinical challenges that you're tending to see overall with this population?
Yeah. No, that is a good way to think about it. I mean, there are individuals who, prognostically, you don't really understand or believe them to be capable of returning back to work, but you should always be listening to your clients and working towards their goals. And whether or not you interpret work literally as something that would help pay the bills, or something that is some other form of occupation, and that gives you structure and meaning throughout your day, that could be another option to be thinking about, and kind of trying to work with counseling on the client towards getting to. With regards to the clients who you do see this as a meaningful long-term goal, one of the worst things that you could do is go back to work too quickly. So you want to make sure, one, that what kind of job the person's getting into. If you cannot return that person back to their previous job, which would be ideal, because the employer has developed relationships. They know, if you've developed good social rapport and social capital in the workplace, they're going to wait for you. Of course, we're talking now about jobs that are kind of more maybe white collar or higher level jobs. And when we look at return to work, people who have more education and return to jobs that require more education do tend to return back to work. Why? Because they've got the employer that's on their side. They've got the health insurance that can get them there. Unfortunately, we see also a lot of people who do not have the health insurance that would be able to get them back, and are maybe working in jobs that don't afford them health insurance, or they do not have very good health insurance through them. So, there's a very practical side to this with regards to what you need to do with whom, and how you need to advocate for your clients.
Yeah, and it's interesting that you say, one of the things that could go wrong is getting that person back to work too soon.
Yep.
Because that's just an interesting pressure, right? Because the client is sometimes pushing that so much, and maybe that's even something we could help counsel our clients about, is just because it's not now doesn't mean it's just not yet. It doesn't mean no forever. And yeah.
And it's not an easy thing to counsel too, because if somebody does want to return back to work and they really feel like work is a big part of their identity, that's the stage of life that they're in. If they're too young or too old, that might not be the case. But it's very important for some people, and it can be very difficult to convince them that they need to still work on some things.
Yep. Now, I know you have been involved in research, and you wrote a tutorial article in 2022 for SLPs about supporting return to work. And I read the article, it was great. And I liked how you help SLPs organize their thinking just by understanding different models or approaches for vocational rehab.
Mm-hmm.
That's something I didn't know about at all. So can you share with us the different approaches that might be considered for vocational rehab?
Yeah. So we had a Voc Rehab counselor or a Voc Rehab specialist on that paper with us. And he was very helpful with this, with providing us with the most up-to-date literature on on those models. So there's a place then train kind of approach where you would work with hopefully a Voc Rehab or case manager or a person's employer who wants them back. And you'd place that person back into the job once you feel like they're capable. Then you want to before you do that though, you want to have a good idea about what's the employer's perspective. What are their criteria for, accuracy and efficiency in the jobs that they're asking you to do. And so you want to make sure that you can get good baselines for those sorts of things by doing any kind of mock-up of work-related activities before you go back into the workplace. And then when the person's placed in the workplace, hopefully you can have either outpatient where you can be working with them, or ideally, if you're a community-based SLP, you can go into the workplace yourself on occasion. If you can at all get a case management to assist you with finding a Voc Rehab counselor that can do on-the-job training and working alongside that Voc Rehab counselor, that's probably the best thing that you can do for place then train. There's another approach where you do train then place. That typically doesn't go as well. It's not as well supported in the literature. People don't tend to hold down their jobs as well. We know that persons with TBI tend to learn experientially and through very context relevant sorts of activities. That's what the INCOG guidelines report, and that's totally how the Ilvasacker kinds of approaches are as well.
Yeah, so like if you're trying to do all this stuff in your outpatient speech therapy office, it's just not necessarily gonna train you. Like if you are like, okay, we did everything here, if it's a different environment, it might not carry over.
That's a good point. As long as you can mock things up and do things as functionally as you can, so that you role play things before they're actually being assessed by their coworkers and employers.
Yeah,
that's very important. But if you work on, decontextualized tasks like workbooks or have them working on a computer games, those obviously do not translate into functional real world outcomes.
Yep. Great. I know there's probably some skills that are we can practice those in speech therapy, but then I like your idea of maybe the gold standard would be getting a Voc Rehab professional. And I'm just going to ask a little tangent about that because I'm curious if different states have different rules about that Voc Rehab professional. I know, so I'm in Michigan and we have a state program. So I always knew when I was doing outpatient therapy, who to call or okay, I'm in over my head and I need that Voc Rehab professional. And so there's an office in my town and I would have that person get involved. But I don't really know how it works in other states. Can you talk about that? If there's an SLP listening who's never thought about a Voc Rehab professional, where do they even start?
Yeah, no. Well, Michigan is a good example of a state that's well positioned for therapists to be working with Voc Rehab, just because historically it's been pretty well funded as far as brain injury waivers and things along those lines, as goes for some other states that I've encountered, Minnesota, Kentucky. But every state has their own Voc Rehab program. I'm not aware of a federal Voc Rehab program. Of course, there's the Department of not education. I'm trying to think now for for the workforce, there are federal governments, federal agencies that are involved with the workforce, but it's going to be a state by state sort of thing. So here in the state of Virginia, it's not even really named. Voc Rehab isn't even in the name. It's called DARS. It's the Department of Aging and Rehabilitation Services. So you might need to do a little bit of looking into things.
Yep. Ours is called Michigan Rehab Services. So same thing. Okay, cool. So speaking of the interprofessional team then and Voc Rehab, what do you see as the gold standard then? If we're working with someone who is going to be, getting back to work, maybe not in the same job, but you're trying to find a way for them to get plugged in. Can you talk about the interprofessional team who might be involved?
Yeah. If you can get a case manager to help you with that team, that would be great. Case managers are extremely important and helpful in brain injury rehab once somebody leaves the hospitals and is in the community setting. So yeah, I would definitely make sure that you're coordinating with a case manager who's also working with a Voc Rehab specialist, OT and PT as needed, of course, for physical deficits. Neuropsychological evaluation is very, very helpful for getting to understand the underlying cognitive deficits. You want to have a physiatrist for managing medications and any other kinds of issues that might be coming up so that you can get the correct referrals that you're going to need. So a PM&R doc or a physiatrist. And then, of course, that Voc Rehab specialist. So if there is somebody who's working with the individual in the workplace, that would be great. Anything that you can do to kind of get an idea of the workplace culture and the nature of the relationships between the employers, the supervisors, and your client will help you understand how you can best advocate for your client as well.
Mm-hmm. Is the Voc Rehab Services, is that usually paid for kind of in the same way that therapy services, like maybe like an insurance covered benefit? Is that typically how it works?
I think of it more along the lines of Medicaid. It's a state sort of run program. So, if you're eligible for it, then the state provides that service for you. And the degree to which the Voc Rehab is, how long they're able to work with you, what kinds of activities, that's going to vary state to state.
Yeah. And I guess that makes sense. Like it's a service that the state would provide because it actually does benefit the state, right? Mm-hmm. If we have people who are working and living meaningful lives.
Oh, if you can get somebody with a brain injury back into the workforce, I mean, you are saving so much money on society in general. Yeah, I mean, you're getting somebody who's not only earning their own paycheck and going to put money back into, the community, but they're no longer taking from, social services and disability if they can get gainful employment. And if that's the goal. So, I mean, the cost benefit ratio is definitely in the benefit is definitely in the rehab. And so there's been some cost benefit papers that have been put out there. And yes, of course, the immediate amount of money that it's going to take to rehab somebody is going to be a lot. And so there's kind of a sticker shock, I think, when you look at the amount of money rehab really does cost. But in the long run, you're making money.
Yeah, it kind of pays off in the long run.
Pays off in the long run, and both for the individual and for society as a whole.
Yep. Awesome.
Yeah.
So back to your tutorial article then, it's great, it's fantastic, and it walks through clinical ideas for SLPs to contribute to the job assessment. So I think this is really great for our listeners just to have some specific ideas. And I thought we could walk through the clinical process then, starting with the assessment. So what are some of the key tasks or the type of information an SLP wants to gather in an assessment for someone who is on this topic? They have a TBI and they want to return to work. What's some of the key info they should be thinking about?
Yeah, so my dissertation did a look at the level of work where most people with traumatic brain injury return to, which is sort of a middle manager kind of position.
Oh,
So, like I said earlier, if you're working and you have a job that gives you insurance and you have responsibilities that your boss really appreciates and is difficult to replace, then yeah, you're going to be returning back to work. So I looked at that level of employment and did some interviews with employers and people who were recommended to me by employers as good communicators in those settings. So out of those interviews, I ended up finding that being able to manage your social presentation is very important. Being able to build social capital, being able to cooperate with others and in a way that makes them want to work with you in the future. I mean, that's going to be important, obviously. I mean, we don't really think about it, but I mean, that's what keeps you in your job is everybody happy around you and in addition to you doing a good job at whatever it is that you're asked to do. And so that social communication piece is very important. Social problem solving and reasoning is going to be important. The speed of processing is going to be important for a lot of settings. Being able to filter out distractions in distracting environments might be a potential barrier. So, you want to make sure that you're looking at auditory processing, visual processing skills, as well as something along the lines of the favors, which would look at reasoning and problem solving and executive functioning in a very task-based way. So
yeah.
those would be the sorts of things that I would recommend.
Awesome. Yeah. And I'll just kind of say, if I can think of it, so that you just mentioned the favors, which it's FAVRES, the
That's right.
functional assessment of verbal reasoning and executive strategies, I
Very
think.
good.
So,
Yes. I
so that is
struggled with getting that
amazing.
name. So yeah, good on you.
Yes. That's an awesome test.
Mhm.
Like you said, it's standardized, but it happens like in a context. So that is a really good one kind of for the skills that you just mentioned. Are there any other tasks that you recommend or draw to? Do you try to do more specific, like contextual observation if someone has a certain type of job?
Yeah, so I was sticking primarily to standardized, static measures as opposed to those dynamic assessments that you were just kind of describing, doing role plays and those sorts of things. Yeah, I mean, if you could do if you have the chance to do some observational assessments, doing a mock-up and being able to identify where the nature of the problems, if you observe them, that are taking the person too long or maybe leading them to have not quite the success with regards to accuracy of what it is that they need to accomplish. Yeah, that's very, very helpful. So you can mock up write an email to your employer or, that's a relatively easy one. I did that with a client recently. And I discovered he did not know how to put an email attachment onto an email, and he is looking for new jobs. So he's probably going to need to attach his resume to an employer and those sorts of things. So just even just by doing these naturalistic observations, you can discover things with regards to things like computer literacy that you had no idea and wasn't even on your target.
Right.
As you're creating your roadmap to returning to work, that's going
Yeah.
to be an important skill that you're going to need to train.
That's a great reminder. Like just by you observing that, I mean, this client would never have said oh, I actually don't know how to attach something. Like that's not something he would bring up as a problem. So by observing, you learn so much in such a fast way. So
Yeah.
yeah.
Yeah. And what really helped there, and this might be a good also be a good thing for assessing the workplace, but what we were doing was I was really trying to assess his executive functioning by seeing, okay, how, let me back up for a second. I was noticing that he wasn't initiating much for home assignments, and he wasn't carrying through with the activities that we were trying to get him to do. One, the big problem was fatigue. I mean, his job is really, digging him, pushing him down into the ground. He is so fatigued, and he has irregular work schedules, which is another thing that's not going to be helpful for somebody with a brain injury. So he works long hours, irregular hours. He's a very physical job, and he's just in no capacity. He has no capacity at the end of the day to really get things done. And so I just asked him to walk me through what are the things he would need to do in order to find a new job, and I scaffolded for him. And so, we looked at, okay, well, we'll want to be able to find jobs that would be willing to hire somebody with a history of a brain injury. So let's get VR on board. We said, do you have a resume? We're going to need to start with a resume. And that's where, do you have an email, that you can put on your resume? So that's where this all started, was just sort of laying down a roadmap for getting this person back into the workforce.
Fantastic. Yeah. And maybe we can think of that as the point of the assessment, right? Is like, you're starting your roadmap with the client.
Yeah. It'll help you get your short-term goals, your long-term goals, and your ultimate aim, which is return to work.
So when we're talking about goals, then what type of goals do you see speech pathologists addressing that would support somebody in the getting back to work goal?
So one of the things that I found pretty interesting when I looked at some of the neuropsychological variables was, with regards to the people that I had run through my studies, I had found that accuracy in a lot of the tasks wasn't necessarily predictive of workplace outcome, but speed of formulation and how well you could get to an answer in a reasonable time frame which was kind of interesting if you think about it. So if somebody's going to hire somebody with disabilities, they know that there are going to be mistakes made. But if it takes forever and you're a month into the job and you find out the person hasn't been able to do anything, that's a little bit different than somebody who can do a quicker turnaround, but the employer can recognize that they're going to need a tune-up. Yeah. So, I would want to make sure that I have a really good idea of what are the expectations of the employer. I want to look at the efficiency and accuracy with which people can do the kinds of tasks that are going to be involved in their everyday work life.
Fantastic. Yeah, it's kind of interesting it sounds like it's kind of just always this balance where we're thinking about the accuracy and efficiency, right? Trying to get both of those.
Yeah. And then also there's the things that you can't really, that are a little bit grayer areas, like social communication. Is this something that could be appropriate in this, is this person's personality going to be appropriate given the workplace culture? What is the work culture look like, and what levels of tolerance do they have for different personalities?
Okay, Peter, guess what? Right now, it is time for the wild card question. Okay, today's wild card question is, what is one medical practice today that people in 100 years are going to think is barbaric?
I don't want you to get any hate mail, but I do think that e-stim for swallowing is that might be considered in the long run a little barbaric. The literature on it is not great, but it seems that people do it all the time, and it seems just entrenched in everyday practice. And even though it's not necessarily, it shouldn't be considered a gold standard of any kind. So I'm thinking that just shocking people is probably not the best way to go about
it. In words, I don't know, but
I know people very much believe in it and swear by it, but the literature is the literature, and that's what I go by. I'm not a dysphagia therapist, so forgive me if I'm overstepping my grounds and not staying in my lane.
I love it. I
send me the hate mail, not you.
Yep. Awesome. Okay, we'll get back to our topic at hand here, return to work. And so Thanks for sharing about things we might think about for the assessment and for setting goals. So now, like, we're at the rubber, where the rubber meets the road. It's time for therapy, time for intervention. Can you talk us through what good therapy for this need looks like? Are there evidence-based interventions we need to be thinking about? Or just would love to hear your thoughts on what the therapy time looks like.
With brain injury, evidence-based interventions oftentimes in my mind are really for very specific types of treatment targets. And return to work is not necessarily a specific treatment target. It's variable. And the individual and how they want to present themselves in the workplace. So if you're working on social communication, that could change. They could have very different targets. So I can't really think of anything that's going to be a prepackaged kind of deal. But I would follow the INCOG guidelines and what the INCOG guidelines have to say. So INCOG guidelines. And in particular, Leanne Torr wrote the most, or was the lead author for the most recent INCOG guidelines for cognitive communication and social communication treatments. And, it just talks a lot about context relevant kinds of training. There's also INCOG guidelines for attention, INCOG guidelines for memory, INCOG guidelines for executive functioning. I said attention, also processing speeds go into that one as well. So, I would try to follow the general guidelines for what to work on with whom it is that you're working with and what is going to be the most important. So having that interview and having that consistent conversation with your client about what are the things that they're seeing day to day, and being able to be nimble enough to change your goals or reword your goals so that you can, or make your goals as broadly written as possible so that you can incorporate new things, is going to probably be a good practice to have when working with somebody. Yeah.
You see, like, most of the time in your work, are people back to work part-time and at the same time receiving speech therapy? Or do you tend to see people for like 4 to 6 weeks in preparation and then they're like, how does it usually work for your practice?
It depends on what their insurance is. And so, if you have relatively short insurance, you might not be able to see them through to the employment, return. If you are able to stagger things out at the end and try and work with somebody, you can also say something along the lines of, okay, well, returning into the workplace is a significant life change. So maybe this is going to be considered a new episode of care. So maybe we can try to petition for more funding now that the person's back in the workforce. And I would also say that a coaching approach, the Ilva Soccer or Mary Kennedy kinds of coaching approaches, are probably going to be really helpful. So job coaching is an approach that's used by VR, especially in the training within the workplace itself. And so when you're working as a coach, you're more along the lines of working alongside, taking the person's skills and trying to emphasize those skills, trying to make sure that that person fits their role as best as possible. So you need to know what the person's position is, so to speak. If you're talking being a coach, what is their job and what's their job description and where do they fit into the workplace? That needs to be understood, and that's a key part of the coaching approach, to be able to work with a person on what's the most.
I know when I would do outpatient therapy and people were kind of like part-time back to work and still coming to therapy, just for like efficiency for my job, what I would try to do with the client is we would like together in our session call the employer and check in. Just because I didn't feel like I had time outside of my clinical load to like be doing all this work, because I was with clients so often. And I also felt like it was, I don't know, just kind of like good for everyone. We all did have to talk a little carefully. because we were all listening, but that's just a little tip of how that's worked for me. And it would help me understand the employer's perspective, which wasn't always the same as the client.
Yeah. I think that's a fantastic activity to do, especially because, the literature shows that people who self-identify as having a brain injury, instead of trying to, mask the fact that they've had an injury in the past and don't really acknowledge that they have a disability, that's probably not going to pan out well in the long run, depending upon the job. And I'm sure there are many cases where it hasn't been a problem, but I would think there are more cases where it is, many more.
Yes, kind of a bigger problem if you don't disclose why you're having the problem, right?
Exactly. Exactly.
So I'd love to hear about, like, your work has been a lot about that, like, social communication, like the pragmatics. Like, what do you even do in therapy? I mean, I can think of many TBI clients who it's like, this is not appropriate. But I think a lot of SLPs, it's like, what do you actually do to address that?
Yeah. So my research primarily looks at discourse evaluation. So I do a discourse analysis of monologues, basically. So I've developed a task called the voicemail elicitation task. Nowadays, people don't use voicemails as often as they did, back in the day. But when I first developed it, voicemails were more common in your.
Now it could be like texting, right?
Now it could be texting, yes. And so I've worked with my colleague Heba El Sayed at Kessler Rehab, working with. The population she works with is adults with high-level autism, young adults with high-level autism. And so she's looked at the voicemail task. She's developed an email task. I would love to develop a texting task. And basically what I look for in there are words and a sense of cooperativity, because the essential component to pragmatics, the Gricean principles, are the cooperativity principles, right? So for pragmatics, if you think of where it comes from, which is a fellow named Grice, talking about manner, relation, quantity and quality of what it is that you say, you'd want to look at, is the person providing too much information? Is the information that they're providing relevant enough? And is it too much information? Is there information in there that's not necessary or, superfluous? And is the manner in which they're saying these things, is that appropriate? And furthermore, I've been looking at what are called politeness markers. And these are words that do not have pictures in the dictionary because they are not a visual word. These are words like just, might, possibly. They are words that purely have a social function to try and mitigate or kind of soften your speech so that you can be more appealing, so you can sound more appealing to your conversation partner. So if you're making a request, you're not flat out making that request and, sound like you're barking orders. It is, you might say, I know that you're busy right now, but if you could possibly give me some time, that would be really helpful, So we find ourselves using those kinds of phrases all the time in the workplace, and there really, really are, the P's and Q's that make, that your mom taught you, and the other thing is, I would work on in order to use those words appropriately, you need to have an appreciation for the thoughts and feelings of your conversation partner. So you wouldn't say that if you knew that the person, didn't care, right? And you had a long-term relationship with them. You can have your own sort of little bit more or less polite kinds of conversation between two people from a linguistic politeness perspective. But you need to be able to get there, and you need to be able to manage your social identity in that workplace. And so you need to be able to appreciate other people's thoughts, other people's feelings. So in my treatment approach, I train politeness markers, would, could, may, might, possibly. And then I promote perspective taking through auditory recording, replaying the audio, and then having the person say, does that sound like the person they want to be in the workplace? They make their own target. Okay. And so we're not going to say what's professional and what's not professional for this person. This person is going to be guiding their own direction into how it is that they want to sound like. They might need a little bit of encouragement to sound more appropriate for workplace. So you might need to do a little bit of coaching or motivational interviewing or some sort of approach that might help the person get to where they need to be in order to understand what makes a good cooperative work partner.
Wow. Yeah. So I'm just going to make sure I understood that. So you kind of train the idea. So we'll just say like those politeness words. Mm-hmm. Then you practice like a little role play, but you record it. And then you like have them listen to themselves, like what they just did and like reflect on how they did.
Yes, exactly.
Yeah. I love that.
And trying to get them to reflect honestly is kind of difficult because it takes a lot. And nobody likes listening to themselves, so it might take a little while to get them to that point. I like to do this because on a computer-based kinds of role plays where there are scripts that I've developed, and it's a safe place to practice. The person can start to see improvements in their target, and they can feel a little bit more confident and prepared when having the social interactions that might be scary for them in the workplace.
Sure. Mm-hmm. Yeah. Awesome. Okay. So if we were going to boil this down to 3 actionable takeaways for clinicians to put into practice, can you give us 3 things to think about?
3 things to think about. Okay. Well, yeah. So I definitely would not disregard the conversation partners in the workplace. You need to know what's happening on the ground, and that means the employer's perspective and colleagues' perspectives. And your client can be a gatekeeper for that kind of stuff, so it can be difficult. But I love the idea of that you had your clients call their employer in the therapy session. That fulfills that one first thing that I'd say. Using real world workplace role play and activities as much as possible. Okay, you need to create. You can't do pen and paper stuff and expect this person to go back to work as you're not training them to the task that they want to do. Yeah. So you really do need to try and develop some mock-ups of the workplace as much as possible. And then also implementing any executive functioning supports. So I talked a little bit about the social communication, but, goal management, some digital tools, just getting them to be able to solve their own problems as much as possible using whatever kinds of supports that are available to them, I think would be another one.
Great. Awesome advice. Let's take those and help the audience think this through with some hypothetical case scenarios, if you don't mind.
Yeah, no, I knew this was coming, so I prepared something, and it's the same case scenario as in my paper. So I might be referring to some notes I put down here.
Oh, fantastic!
Yeah, so in that we followed another of the authors on that paper is Rick Lemoncello. We followed one of his clients. Rick Lemoncello's at Portland State University, and he is an expert with work return as well. He runs a bakery called Sarah Baar's Bakery. Haha, get it? Sarah Baar.
This is the first time I'm actually getting it. I've seen it in print and I've never heard it. I get it now. Okay.
You got to say it out loud in order to hear it. Yeah. You can see it in print and it won't click, but you need to hear it. Yeah. So Sarah Baar Bakery. He had a client named Jason. I think that's a protected name. And he was in his mid-20s. He had to fall down the stairs at home. And he worked various construction kinds of jobs. He was just a blue collar kind of guy, working unofficially sort of in the trades kind of thing is my impression of him. And one of his main goals was to return back to work. I mean, he was a workaholic. He couldn't see his job. He couldn't see his life really without some sort of employment being involved with it. So he had some significant cognitive impairment. So he had severe memory difficulties, left visual field cut, difficulties following work routines and procedures. There's a whole list of, what the assessment provided to Rick in the paper. Now, Jason was referred to Sarah Baar's Bakery and Workshop. It's a nonprofit. They use a place, then train model that was discussed earlier, and also is highlighted in the book. So that's where you get on-the-job experience first. Then you train with support on the job as well. So the bakery was a good fit for Jason because it was structured, predictable, offered real work experience, team-based, and it was run by a speech-language pathologist with graduate students there and other professionals to help train with support in the context with which he was trying to learn the tasks. So he had adopted some memory strategies, so some of the executive functioning and memory strategies using external devices as well as internal strategies. He had visual cues that he placed around the workshop itself, so around the kitchen, to help him with sequencing and organizing and making sure that the steps were followed in order for the cakes to rise. He had job coaching, and after 6 months, he had mastered the basic work tasks. And so you want to get to the client to be at the point of mastery before you can try and say, all right, let's see how you do, and back off. But it took him 6 months. He was promoted to a part-time paid position as a pie baker. During the interview for this paper, he had said that the bakery gave him a reason to wake up in the morning. He learned skills in the bakery that transferred to his home life. So he had begun to use a planner. He had never had done that before his injury, and hadn't been doing that before he had attempted to return to work. And so, workplace integration is really important. And the contextualization as much as possible of the training is really key. It needs to be done in something that can be translated to that employment. So that was the case study that we had in our paper. And one day, hopefully I'll be able to meet this guy and travel up.
Yes. I feel that's a great example. I feel like it just really shows this isn't just one other checklist item on the recovery list, but it gives to so many parts of a person's life. Yeah. And that's clear with his, the bakery gives me a reason to wake up in the morning. Yeah. So
that's a powerful statement.
Yeah, it really is. So, well, thank you so much for sharing your expertise with us, kind of encouraging us to find those services in our states and know the right person to get plugged in. And then together we can meet some important goals for clients. As we wrap up, do you have any final words of wisdom or inspiration that you want to leave with the audience?
Yeah. So, just where we left off, work is more than a paycheck. It's your identity, your purpose, your connection to other people as an adult. So, for individuals with brain injury, it has a lot to do with communication and relationships. And because of that, speech language pathologists have a really profound and important role with regards to return to work, in my mind. We have a set of skills that are going to be necessary for almost any employment setting. So when we train the employment setting to be communication friendly to persons with disabilities, and when we equip individuals to return back to those placements, we're creating opportunities for sustainable employment and also helping that person have their own dignity. Have a good sense of dignity. I'm getting up in the morning for a reason.
Yes. Thank you so much. That's all the time we have for today, but thank you, Dr. Peter Meulenbroek, for the insight, the clinical takeaways related to TBI and returning to work.
Thank you, Sarah. It was a lot of fun.
Thank you for tuning in to this episode of Speech Scope by MedBridge. Please be sure to subscribe and listen to more of our episodes on Spotify or on your favorite podcast platform and at medbridge.com. If you're listening outside of the MedBridge catalog and would like to access the bonus resources and receive continuing education credit, simply log into your MedBridge account and search for this episode to find the accreditation details. SpeechScope also listens to you. If there's a particular clinician that you'd like to hear from, or if you have a clinical question or challenge that you'd like to see addressed on this podcast, please let us know by leaving a comment on our Instagram posts or by emailing podcasts@medbridge.com.